Welcome to This Explainer. I'm so glad you're here. Today, we're going to take a really calm, totally evidence-based look at the absolute essentials of post-sex hygiene. If you have ever felt completely overwhelmed by all the conflicting advice out there, or just really frustrated by post-sex pelvic irritation, you are in a safe space right now. I hear you, and your discomfort is so valid. Let's just dive right into our very first question here. Do you really need to sprint to the shower the literal second sex is over? I mean, so many of us have this deeply ingrained panic, right? Like the moment intimacy ends, the clock is suddenly ticking, and we absolutely must rush to the bathroom to scrub ourselves clean. Well, let's take a collective deep breath and just completely debunk this stressful myth right now. You do not have to jump out of bed and ruin the moment. Intimacy naturally involves body fluids, lubricants, closeness, and your body's actually incredibly resilient. You have time to relax. As we move through this explainer, my goal is to lower that anxiety for you and show you what actually matters for your health, completely panic-free.
But before we get into the nitty-gritty specifics, let me just quickly introduce myself. I'm a specialized female pelvic floor physiotherapist at OVA Women's Health. In my clinic, I see women literally every single day who are just so frustrated by chronic infections, micro tears, and these awful burning sensations that totally disrupt their intimate lives. At OVA Women's Health, our entire focus is on specialist pelvic care. I really want to reassure you that if you've experienced pain or discomfort after intimacy, you are not crazy. Your experiences are completely valid, and more importantly, they are so treatable. You really deserve specialist care that listens to you, and today, I'm bringing all that clinical expertise right directly to you.
Okay, so proper aftercare isn't simply about, cleanliness in the way we might think of scrubbing a dirty kitchen floor. It's really about balance, comfort, and prevention. Your intimate area actually has this highly intelligent, completely natural protective barrier. Our whole goal with post-sex hygiene is to just gently support that barrier. We want to prevent unnecessary infections and irritation while making sure you actually feel physically comfortable. Honestly, over-cleansing can absolutely be your worst enemy here. The big takeaway is that we're looking to maintain your body's beautiful natural harmony, definitely not sterilize it.
Now, to achieve that perfect balance, we've got to grasp one incredibly fundamental concept. Because let's face it, you can't properly care for something you don't clearly understand. We so often hear the terms vulva and vagina tossed around interchangeably, but clinically speaking, they are entirely different environments that need completely different types of care. The vulva is the external, visible part of your anatomy. The vagina, on the other hand, is the internal muscular canal that goes right up to the cervix. Truly understanding this distinction is the absolute key to stopping preventable irritation right in its tracks. So looking at that external anatomy, the vulva, we're talking about the labia majora, the outer lips with hair, the labia minora, the clitoris, the urethra, and the vaginal opening. Now, why am I listing out all these specific parts? Well, because this external area is literally the only area that requires any sort of active cleansing routine from you. This is the spot where lubricants, sweat, and bodily fluids can kind of just sit on the skin, which can potentially cause topical irritation if they're left to dry. So this is your primary focus area for post-sex comfort. And here is a powerful, totally non-negotiable medical fact for you. The vagina is self-cleaning. I really want you to just let that sink in for a second. That internal canal we just talked about, it is a self-regulating, absolutely brilliant little ecosystem. It literally uses its own natural discharge to continuously cleanse itself, maintain a highly specific acidic pH of around 3.8 to 4.5, and fight off any bad bacteria. You do not, I repeat, do not need to help it clean itself. In fact, attempting to do so is exactly where so many issues start. Your body is incredibly smart on its own. Building right off that fact, we arrive at a super critical warning. Never, ever douche or use harsh cleansers internally. Aggressively scrubbing or, using those heavily scented products, wipes, or douches inside the vagina completely wreaks havoc on that natural discharge process we just praised. It's heartbreaking, really. Women spend hundreds, sometimes thousands of dollars on treatments, medications, and specialized appointments trying to fix chronic yeast infections, bacterial vaginosis, and severe irritation. And the crazy part? A lot of those issues were actually triggered by over-cleaning in the first place. So please, leave the inside alone and let your body do its magnificent job. So what should you actually do? Wash only the vulva, that external area we defined earlier, and do it gently. You absolutely don't need any of those fancy, expensive, heavily marketed feminine washes. All you need is some lukewarm water or at the very most, a super mild unscented soap. Use your hand, Definitely skip the harsh washcloths and just gently clear away any leftover fluids or lubricants from the external skin. This simple, gentle act is going to ensure pure comfort, prevent any skin breakdown, and perfectly maintain that healthy pH balance we love. All right, now we get to the absolute gold standard of post-sex hygiene for women. Step 1, keep water by the bed. Step 2, urinate within a reasonable time. Seriously, emptying your bladder is the single most crucial activity you can do. During intimacy, bacteria can so easily get pushed toward or introduced right into the urethra, which is that small opening where you pee. By drinking a little water and urinating after sex, you're naturally and effectively flushing out that bacteria before it even has a chance to travel up into your bladder. This one simple habit drastically reduces your risk of getting those incredibly painful urinary tract infections or UTIs. But remember what we talked about earlier? You do not have to panic. You have plenty of time. You absolutely don't need to jump out of bed the second your partner pulls away. You can totally cherish your aftercare, cuddle up, and just enjoy the intimacy of the moment. The general clinical guideline is simply to not wait more than an hour to void. So just keep a glass of water on your nightstand, take a few sips, relax, and whenever you feel that natural urge within that hour window, just go ahead and use the bathroom. Easy as that.
Okay, I want to shift gears to some specific scenarios now, starting with anal sex. The anatomy here is pretty different. The anal sphincter can actually develop these tiny microscopic tears during penetration. And because of the nature of that specific area, bacteria or fecal matter can easily get trapped right in those tiny tears, which can lead to localized infections or really painful fissures. So for this scenario, thorough cleansing of the anal region before and especially after is absolutely crucial. A really good shower with gentle soap and water is essential here, just to keep that tissue perfectly safe and healthy.
And that brings us right to a very clear, totally non-judgmental, but incredibly important clinical directive. You should never, under any circumstances, transition from anal penetration to vaginal penetration without proper cleaning or changing a condom. The bacteria that naturally live in the anal canal are totally healthy down there, but they are incredibly harmful if they get introduced directly into the vaginal canal or the urethra. It is quite literally a one-way ticket to severe bacterial vaginosis or a very serious UTI. So always practice safe transitions. Now, let's talk about something else that is a total game changer for preventing irritation: lubrication. A clean, non-irritating lubricant prevents post-sex friction. And I just want to validate something for you right now. Vaginal dryness is entirely 100% normal, whether it's due to where you are in your menstrual cycle, hormonal changes, pregnancy, postpartum, perimenopause, or menopause. Our bodies change, and that's okay. But when there is a lack of natural moisture, friction during sex causes those pesky micro tears in the delicate vulvar and vaginal tissues. And those tears sting, they burn, and they practically invite infection in. So using a high-quality lubricant isn't just about making things feel better, it's a vital proactive hygiene step.
At the end of the day, your body deserves care that goes way beyond the act itself. So often we kind of separate intimacy from our general health, but the reality is they are deeply connected. I want to offer you that emotional validation once again. If you have been silently suffering from burning after sex, recurring UTIs, or raw, irritated skin, you should not just accept chronic irritation as your normal. You absolutely deserve a comfortable, completely pain-free post-sex experience. Good hygiene and good care are truly just acts of self-love.
So let's wrap all of this up into a super easy-to-digest routine that you can confidently implement tonight. Your essential aftercare really just comes down to these 4 basic pillars. Number 1, urinate within an hour to flush that urethra and prevent UTIs. Number 2, absolutely do not douche or clean the internal vaginal canal, ever. Number 3, gently wash the external vulva only using lukewarm water or a mild unscented soap. And finally, number 4, use safe, non-irritating lubrication to prevent those friction-induced micro tears. It really is that simple and that balanced. If you're sitting there looking for some more detailed guidance, we've actually created a fantastic resource specifically for you. You can just scan the QR code right there on the screen to instantly download our comprehensive Feminine Hygiene Guide ebook for just $9.99. It dives way deeper into all the best patient-recommended products, how to perfectly balance your pH, and the long-term care strategies that I share with my own patients in the clinic. And hey, if you feel like you need more personalized one-on-one help, you can also use our website to book an unhurried, totally safe space appointment with us directly at OVA Women's Health. We specialize in exactly this, and we're always here to listen. I'm going to leave you with this final thought and a bit of a provocative question today. Are you ready to stop letting completely preventable irritation dictate your intimate life? Because you are absolutely in control of your pelvic health. With the right knowledge, like all the stuff we covered today, and the right specialist support, having a comfortable, pain-free intimate life is entirely within your reach. Thank you so much for joining me for this explainer. Remember, specialist help is just one step away. Take really good care of yourselves.